Welcome to this episode of Carefulist the podcast. We're so glad you could join us today. We have Molly Minnick from Health Advocate joining us, and she is an RN with tons of experience. So let's dive right into your caregiving background.
All right. Thank you for having me and for always supporting caregivers. Yeah, my name is Molly Minnick. I am a nurse for about 20 years now. My caregiving journey is mostly professional. I started as a nurse on a cardiac unit and got to see, the wonders of modern medicine. But with that, I also got to see where there is a lack of education and support in what all of those interventions look like. And that
Yeah.
eventually brought me to palliative care as, going down that road with presenting different options of a journey and what that looks like for patients. So I did palliative home care for about 6 months. That is really where I was exposed to what caregiving is. I went into the house as a nurse who had the education, the background, and getting paid for what I do, and went into homes and saw caregivers being physical therapists, occupational therapists, nurses, working night shift and coming back and taking care of people, and all that goes into caregiving and what that looked like for families. So that exposure really led me down a path to wanting to advocate for caregivers. I worked on a project with the Rosalynn Carter Institute for Caregivers, which is such a great resource and program, and it's just amazing. And I was a coach for a team that worked with caregivers who were caring for a loved one with dementia, coaching through, behavioral modifications, caregiver support, educating, kind of running the gamut.
Hmm.
Um, and that was really an awesome, again, exposure. As I was having these exposures, it just really affirmed for me that I needed to be in a role of supporting caregivers. Um, I work for Health Advocate as a personal health advocate. And we basically help people efficiently use their benefits and also find resources and education and all of this because our healthcare system is can be difficult.
Yeah.
um, with that exposure, again seeing the deficits of the healthcare system,
Hmm.
knowing that a lot of these deficits are affecting our elderly population, our caregivers, our palliative care population, as that's a passion of my heart. And then now I am leading a program that's supporting working caregivers and, you know, working caregivers who are caring for either a spouse or an elderly parent. Ideally, we'll be able to expand that, but right now that's kind of our role in that. So it's a program that employers can provide for their employees.
Yeah.
So kind of organically led into this role of advocacy for supporting caregivers.
Right. Well, we certainly appreciate it. So
Thanks.
the
Thanks.
first question I have, you've mentioned palliative care a couple of times. Can you explain to our audience what palliative care is and what it means?
Yeah, sure, sure. So palliative care is basically a field of medicine that has grown. It's kind of a basis of medicine, in my opinion, but it has grown in the past 10, 20 years. When someone is diagnosed with a chronic illness that they're going to have, through life and basically into death, um, palliative care can come in to support symptom management and quality of life. You can still be receiving treatments and seeking a cure and, doing all of those things, which is a little bit different than hospice. So it's kind of, people say the step before hospice, but it doesn't have to be. It can be involved intermittently throughout your, I guess, diagnosis, and as you need symptom management, more of a holistic look of symptom management and care.
Okay. Yeah, that's an important distinction because, a lot of people don't know the difference between palliative care and hospice, and
Hmm.
they are not the same. So if you take nothing
Hmm.
else from this conversation, palliative care and
Yes.
hospice are two
Yes.
different things. Um,
Yes.
with palliative care, you still have options for treatment.
Hmm.
And so you can still seek that out and receive the assistance in the symptom management home, like Molly just mentioned. Um, Hospice means that there's either no route left for treatment or that you've decided you've had enough treatment and you want to spend the rest of your time outside of treatment.
Yeah.
And still with, people coming to your home and helping to make you comfortable and things like that.
Yeah, and I think when I was saying about the cardiac floor, how that led me to palliative care is, working night shift and getting someone ready for a surgery they're having the next day, and they're like, I don't know if I want to do this. And and then I would ask, like, has anyone talked to you? What happens if you don't? And with palliative care, you could still do it or not do it, but it just started all these conversations where I don't think people were really aware of what the options can be, and so
Yeah.
many times people get intervention, 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 and then someone says they're ready for hospice, but there could
Mhm.
be a whole in between where statistically your quality of life is improved when palliative care is involved and your symptom management is improved, and it doesn't mean that you're hospice ready. And I think people hear palliative and get nervous and they're like, we didn't know we were there yet,
Mhm.
but it actually is something that the earlier you get it involved, the longer that statistically you can live longer and more comfortably.
Yeah.
So I am a big advocate for getting palliative care involved as soon as possible.
So that's a really good point. So if somebody's in the position where they have a chronic illness or they have something that is progressing, who do they talk to about palliative? I can say that word,
It's a hard one,
palliative
palliative.
care.
Yep.
Who do they
Spelling
talk
it's a whole
to?
different thing.
Yeah, but blah, blah. Um, how how do they bring that up, and who do they bring it up to if it's not being actively talked about
Yeah,
on the side of the healthcare provider?
definitely. So you could start with your primary care doctor. That's someone who you can, always bring anything up to, especially because if when it becomes home care, your primary care doctor is kind of going to be the center of your medical team. So it's really good to find a primary care doctor who is familiar with these types
Mhm.
of options, so they are the ones bringing it up. So sometimes you have to do that initial advocacy for
Mhm.
yourself. Your oncologist if it's a cancer diagnosis, or a movement specialist if it's your neurologist. So I always suggest primary care. Sometimes primary care doctors aren't always confident in ordering it or starting it, and they might need a little nudge too, and you can always bring it up to a specialist if you're seeing a specialist as well.
Okay. Oh, that's really good to know. Thank you.
Yeah, yeah, sure,
Um,
sure.
yeah. Anything else from a palliative care perspective that people should be aware of or that you think they should know?
um I think just keeping in mind that even though the word sounds scary, in its root, it's actually comfort, so it's
Mhm.
actually providing a quality of life for your symptoms. So, like we already established, you can still be seeking your treatments and all of that, but it is great because you can start to think on the path of, what do I want my life to look like? What do I want the outcome to be? And obviously we never know what like an ideal outcome is, but I think getting palliative care involved and then hospice later, because I'm also an advocate for that, it allows there to be some individual power, is not the right word I'm looking for, but individual power in a time that seems out of control,
Yes.
so it gives options, and you can start sooner in the decisions that might have to be made and get a better outlook before it's crisis mode and you have to make those decisions. So I think it allows for starting to create a plan in place before you need it,
Yeah,
which can be really huge.
right. So you've used the term advocate, which is also right in the title of the company where you work, Health Advocate. Um, I was on the site and they use the term nurse advocate. And that is really kind of the focal point of the new program that you have. So do you want to talk a little bit about the new program and how nurse advocates factor into that?
Sure, sure. Um, I'm really excited about this program. It was something that, Health Advocate as a company has all these different departments in it. They have a benefits department, claims, appeals department, wellness department, chronic care solution department, a nursing department or clinical department. And as a company, they kind of recognize the need for the caregiver support in elder care and our aging population, and that a lot of what is needed is there already. It just needed to be focused,
Mhm.
Um, so I think that's where the nurse coaches come in, the nurse advocates come in. So they're leading the program. The nurse advocates, they have special training in elder care and coordination and advocacy. We also have all of those other team members, Medicare, Medicaid specialists on the team, appeal specialists, claims specialists, EAP. We have a financial and a legal consult as part of it. So really, and because I'm a medical background, when you think of a multidisciplinary approach, that's what it is in a different way than I've been used to, but it
Yeah,
really is what's needed. It's
right.
efficiently providing resources along with a bunch of other support, support for caregivers, which we can get into in a little bit if you want. But
Yeah.
so that's where the nurse coach comes into play. Basically, like any coach, I guess, is to
Mhm.
efficiently educate and encourage and provide resources and steps in this world that doesn't really have a protocol or there's a lot of books out there, but it's a unique experience for everyone, although there are steps that can be taken to
Right.
get a good plan going.
Yeah. And you said the magic phrase unique experience for everyone. We heard that with my mom's dementia, like there are certain illnesses or diseases that follow a path and you can kind of expect this is what's going to happen. With dementia, it was nobody knows nothing.
I
And
know.
you can have a little, it's like being at the worst buffet ever, like you can have a little bit of, you can have a little bit of that. You might start with dessert and end up over here. Like you don't know.
Yeah.
Um, so it is really, really helpful to have a service available that knows, even if every situation is unique, they can hear your story and know your situation and then say, based on what you've told me and where you are, these are the things that you need to do. And that's one of the biggest things that we struggled with personally. And I know, generally speaking, when I talk to different caregivers, that's the big challenge.
Yeah. And I am learning so much more about, even with dementia, there are things that can be, as I speak with someone and they don't know what to do when it's safe at home, when it's time to think about a facility, how to pay for a facility, how to pay for home care when someone needs to be home. And although it is unique and the paths are different, there are things that you can do ahead of time. And there are things that you can kind of create the picture for everyone. This is when it's safe to be at home. This is when you have to start thinking about something else and getting the care in the home to then see a facility if that's what you want, or if aging at home is what you need, then you have to have a very comprehensive home care plan. And
Yeah.
I was working with someone this week and kind of broke up like this would be the path at home
Mhm.
for a typical case. The timelines might be different, but eventually what happens is similar,
Mhm.
in some cases. But and she said, okay, so it's not unique. And I said, no, it is absolutely unique. It's unique to you, it's unique to your family dynamic, the symptoms that are showing from the buffet, like that is all unique. But what is similar and where the support is needed is that there is going to need to be a comprehensive home care plan.
Mhm.
That is necessary. How to get started on that is really overwhelming for everybody,
Yeah.
So having a way to have this multidisciplinary approach has been really helpful to pull all the different, team members in at different times.
Mhm.
And if you're thinking about a facility, you may have to put the home care plan into place first to get on a list for a facility and figure out how you're going to pay for it and moving assets around and,
Right.
all of that. So it is very unique, but there are absolutely steps that you can take to make it, I was going to say easier, but that's like not even a word that we can
Yeah.
even put in. Yeah. To make it
Efficient,
efficient,
streamlined.
efficient or something,
Yeah. Right.
a plan, to have a plan.
Yes. And, that is so helpful because there are pieces of caregiving that aren't even on your radar when you first start caregiving. You think, oh, well, this person is sick, or they fell, or they were diagnosed with this, whatever the situation. I'm going to take care of them. But you're not thinking, I'm going to need a lawyer so that I can get power of attorney for making medical decisions if they become incapable for one reason or another. I'm
Yeah.
going to need to talk to a financial planner because if they want to age at home and we have to bring in care, how do we pay for that if it's not covered for
Yeah.
whatever reason, if they're not old enough for Medicare, or if Medicare they don't have the right part, or just
Yeah.
navigating that in and of itself is a nightmare.
Yeah. Yeah. And I think too, what I have been, I guess, pleasantly surprised with the program is that there are people who are calling in and saying, I am expecting to take care of my parents. I moved closer to them during COVID because I wanted to be close and thinking ahead that I want to take care of them. What are things I can do now? It's not even that they
Yes.
had a specific diagnosis. And have those calls. I'm like, wow, I'm so proud that you're doing this and this is
Mhm.
great. And here's some of the things to think about. And, um, it's great that it's on your radar and there's a lot that can go into it and it's really great to take care of some of it first. That being said,
Yeah.
there's also people who are like, I am knee deep in this. I didn't even know that there was support out there. Now
Yep.
I'm getting all of this information and it kind of feels like noise sometimes when you have too many resources just thrown at
Yep.
you or too many opinions on what you're supposed to be doing. And that can make it really difficult to, kind of look through everything and figure out what is going to work for you.
Mhm. Yeah. It's sort of the worst part of every big project, right? Like, where do I start? What is my first step? And then once you take that first step, you start walking. It's little steps at a time, but just taking that first step is the hardest part, but it's the most important thing because once you do that, it becomes easier. And this is top of mind for me because I have school aged kids. So we're talking about school projects and
Yeah.
things that they're working on. And it's like, well, you do have a 250-page book to read, but you don't have to read all 250 pages today. Can you read chapter one today?
Yeah.
So, unfortunately, put your mind back to school a little bit
Yeah. Yeah.
and
Yep.
think about how you're going to tackle a big project one little chunk at a time. And I think that's something that Health Advocate is really, really good at, being that one starting point, like that
Yeah.
one phone call, that first step you make, that gets the ball rolling. And then you have so much help. It becomes like the best group project, not the
Yeah.
worst
Yeah.
group
There you go.
project.
Yeah. And it's great because I think one of the things is that it is the nurse coach who is your outreach. So even as we pull these other, the other departments in and the other consults in, um, we can have it, we can set that up for you. We can be a part of it. We work with the member is what we have for Health Advocate. They're considered members and we work with the members where they are. So even in that book, if do you know the books where you can like choose you
Choose
read
your
a
own
chapter
adventure.
and then choose your adventure. So,
Yeah.
like for example, I had one person that we were kind of starting at the beginning of just getting some of the advanced documents together and um, scheduling the appointment with the primary caregiver to show what things are needed to try to get home care in the home, Medicare skilled home care. And then I called one day to just follow up on the advance directive. And she said, my mom totally lost hearing yesterday, completely lost hearing. And we had a cardiology appointment. He's not worried. He doesn't think it's a stroke. So we're just at home trying to figure it out. And I was like, all right, well, that was plot twist for me, you know?
Yeah.
Um, but we ended up, you know, unfortunately, she couldn't see an audiologist for like 2 months. So we went a backwards route and had her make a comprehensive appointment with her hearing aid company. And that was, they were able to have a provider take a look at her ears, rule out that it was a hearing aid,
Mhm.
move up the audiology appointment with that information, you know. So it
Yeah.
was, I think when you have one outlet, you know, I was encouraging her. I'm like, next time that happens, call and we'll see,
Mhm.
you know, we'll see what we can do here. And she was like, I don't know why I didn't call. I just didn't think that this was something to bring
Yeah.
up, you know, but now that you are doing this or creating this plan, it makes sense to have an
Mhm.
outreach to run an idea by, or, you know, with the Rosalynn Carter Institute for Caregivers, a lot of times if there was a new behavior that came up, that was our focus for that session. And then we
Mhm.
would come up with trial interventions and then revisit it the next time. And that behavior may have gotten better, may have disappeared, you know, or may still be there and those interventions didn't work, but it's still having an outlet to discuss these things instead of just kind of reaching for, you know, resources, I guess.
Yeah. Yeah. And that's a key thing to consider. So much of caregiving is this sort of plateau and then plummet and then
Mm-hmm.
plateau and then plummet. And thankfully, a lot of folks, it also comes back up.
Yeah.
Um, my experience with dementia, so it was always plateau and plummet.
Mm-hmm.
But depending what your situation is, there is that rebound and hopefully recovery.
Mm-hmm.
Um, but anytime you have a major change like that, it's really jarring. And so you have it's sort of like mini crises amongst the big crisis, right?
Mm-hmm. Yeah. Yeah.
So then you're like, okay, well, I have this new crisis. So I'm just starting to respond to this and I'm trying to figure it out. And what do we do? And then things settle down. And then this is kind of like the new normal. And having someone to reach out to who can help you navigate those little mini crises as they come up, you can't put a value on that because it really gets at the heart of what I think a lot of caregivers, I know a lot of caregivers struggle with, which is isolation and feeling like they're doing it by themselves.
Yeah.
And, that's why I was so happy to be able to talk with you and learn more about Health Advocate because you don't have to do it by yourself.
Yeah.
Um, so if somebody's listening to this and their company doesn't currently offer Health Advocate, um, how how would you advise them to talk to their leadership and maybe who are the key people within a company that they might bring it up to?
Yeah, sure. So, HR is definitely, you know, the person, the first outreach I would do. I would encourage you to reach out to HR at the beginning of a caregiving journey to say, you know, what kind of support can you provide for me? There might be things in place already that, you know, you're unaware of. Employers can be a really huge part of, I think, this crisis that's happening. They can be a really huge part of the solution.
Yeah.
They can even, you know, flexible hours, remote work, all of those things. And not all employers can offer that, but they can offer support programs. So I think employers can be a really huge part of this. So I would suggest talking to your HR, seeing what they do have available for you already. If you're interested in the Generations program through Health Advocate specifically, I can give you a link that someone could send to their HR to take a look at it. And I think that's a really great place to start, because at this point, there's sort of a disconnect of employers who, employers thinking that this is like 20% of employers think that this is an issue, and 80% of employees know that this is a concern. They're
Yeah.
having to spend hours at work doing these tasks, making these phone calls to insurance companies, Medicare, home care providers, on behalf of someone,
Mhm.
having to miss work for appointments, having to miss work for a crisis call. Um,
Yes.
and I think a lot of times too, we have long distance caregivers who don't necessarily know, they can't be hands on and bedside. That's actually, I miss being bedside and hands on with people, but I'm realizing that this is a way to reach more people and
Mhm.
caregivers who are long distance caregivers. This could be a program, this could be a way to help and get involved and take some of those tasks away from the person who is hands on,
Mhm.
your sister or whoever it is, your brother, grandchildren, caregivers, or everybody. But,
Yeah.
I think it's a really good way to uh, have anyone be involved, even if you can't be physically there.
Yeah. So in one of our previous conversations, you were mentioning that Health Advocate had recently done a survey. And I know you just dropped a couple of those statistics there with 20% of the companies think that there's challenge and 80% of employees are like, hello, I
Yeah,
need some
here we
help.
are.
Um, so is there anything else that came from that survey that you think would, be of interest for the audience to know?
Probably. I have it up here too. And I think they're going to
Okay.
put it live Friday, so I can send that link. But basically, they sent out a survey to 350 working caregivers caring for an elderly parent or spouse in caregiving.
Mhm.
And not surprising is like the tasks that everybody does. So, performing household tasks, medication management, doctor's appointments, personal care, coordinating healthcare services. 75% of caregivers do all of those things.
Yeah.
Um, and also, probably not surprising to anyone who's a caregiver or in the caregiver support community, is that 70% of people report a caregiver burnout of 5 or higher.
Yeah.
So some of the other things, 90% of caregivers are spending 10 hours a week, 50% are 20 or more. Um, and
On
40
caregiving?
on caregiving, spent on caregiving.
Wow.
And 40% of people are using work time to do that.
Yeah.
So, because you have to, if you have your own family and then you're also caregiving and you're working in between, like when are you supposed to do all of these things? You can't.
Right.
It's not fair. People shouldn't be doing this without support or alone.
Yeah. Well, and a lot
And
of the things that you need to do, the appointments and things like that, you have to do during the workday because that's when they're open.
right.
So that's, one of the biggest challenges and one of the most common, not complaints I hear, but frustrations I hear from working people. Like I only have a certain amount of time that I'm allowed to take, but I constantly have to use my vacation time or my paid time off to take my loved one to their doctor's appointment because
Mhm.
they're open during business hours. So
Right.
that's where you really get into this friction point
Mhm.
where if a company doesn't offer flexible hours, or if it's a role that they can't, I mean, there are some jobs that
Right.
you just have to be there. That's what it is.
Right.
But then what do they do?
Yeah. I think
And
one of the things that is great, I think, about a nurse coach or someone who's been through it before. You've been through this and have done the doctor's appointments with a loved one. I think it's having those appointments be more efficient as well. So I've been doing, preps with the patients and caregivers about kind of what the goal of that appointment is,
Mhm.
and writing a summary and sending that to the doctor beforehand. So if
Mm,
it's a new diagnosis or someone's noticing new symptoms, some questions to ask, some guidance to get from the doctor. If it's time to get home care involved, that's the focus of that appointment, so that you don't go and, you know, especially in an elderly population, they might say, I'm fine, everything's fine. And you're like, what? You had an assisted fall yesterday and you can't,
Yeah.
you know, you just told me that you're doing this and this. So having that beforehand to say, here's the, you know, we even have different checklists to do before to say, you know, what are the ADLs? Are we needing assistance with this? What does the home look like? What are the things that are necessary for safety and being at home? And having
Mhm.
that ready for the appointment. And then you can go and say, what we really need is skilled home care involved at this point. From this information, can you get it ordered and can they be there in 24 to 48 hours? Here is an agency that's in network and available in your neighborhood. Here's why we
Mhm.
know it's needed. Maybe palliative care at that point because we've already discussed it and bringing it up. So I think having a more efficient doctor's appointments and then the follow up. I can follow up and say, did you send that order for this? Did you do this? So then a week doesn't go by and someone's like, wait, I thought we were supposed to have a physical therapist coming out today and we don't. So
Right.
um, I think you know, the doctor's appointments still do need to happen. One of the things that we have done, if people are interested, is being present virtually at an appointment on the phone, or a lot of times still a family member does need to be there for transportation purposes and all of that. But if it's someone who could be more independent, or if a family just wants someone there to advocate on their behalf, that's something that we can do as well. So I think um, that can help with the number of doctor's appointments. And
Yeah.
some of it can be done without a doctor's appointment too, if it's coordinated
Yeah.
correctly.
Right.
You know.
Yeah. I mean, that's a huge piece of it is being prepared for your doctor's appointment.
Hmm.
And people will list things that have happened or whatever, but you only have that 10 to 15 minutes with the doctor. And if you're not asking the questions that are going to make their ears perk up,
Hmm.
you could very easily be set up for another appointment or two or tests or whatever.
Yeah.
So at this point, it's really hard to know what to ask. So that's really a huge case for having an advocate with a clinical background who knows the
Yeah.
questions to ask and how to get their attention. And the other challenge I see and hear is doctors' word is gospel, right?
Hmm.
So, like, if a doctor says something, particularly, for certain generations or certain personality types, like, they're not going to push back against the doctor. Doctor
Hmm.
said this, so this is what it is.
Yep.
Um, and I am not railing against doctors. We need them, we love them,
Hmm.
but they're also in a hurry. So they're trying to make a diagnosis or make things better very, very quickly to get
Yeah.
to the next patient. And sometimes they'll miss stuff
Yep.
because they're in a hurry or because there's so many screens in front of them that they have to fill out and answer all of these questions. They're only partially listening to you.
Yeah.
Um, and that's not a fail on their part. It's a fail of the way that the system works.
Yeah, and I think too, some doctors too, if you think of like a family doctor, they're the span of ages and
Hmm.
diagnosis and healthy, you know, that well-being healthy could be where they're not to well, I guess, you know, with a diagnosis, not to say that you're not healthy, but I'm saying I guess they might not know what to do. So
Hmm.
I think also finding a provider, which is something that our team does, finding an in-network primary care doctor with expertise in geriatric care or in your specific diagnosis is really important because then that streamlines a lot of the communication between your medical team.
Yeah.
You know, as when we do this program, we start with an caregiver intake, care recipient intake, so that we can really form a comprehensive plan. But in that, one of the questions is, how satisfied are you with your communication with your team? And a lot of times people are not. They don't get to talk to the team. When they do, the team's like, make an appointment. Then you wait 6 months to see a neurologist and they say, there's no guideline for dementia. What do you want me to say? Well, that's not okay. We waited 6 months to come see you and your responses go free. You know, that's not
Yeah.
supportive, that's not okay, that's not, and again, it's not to knock doctors, but it might be that it's time to find a different doctor who really can step in and help for that, or a coordinator or a social worker, and I think oncology has done a really great job of forming teams that when you have this diagnosis, you're met with a social worker and doing all of these things. I
Mhm.
unfortunately, dementia is not there yet, but that's changing rapidly. Even with uh, government involvements and grants, and it's a field that is opening up and finally getting support.
Mhm.
Um, but that doesn't mean that the providers who are placing the orders are necessarily up to speed on it just yet. So I think
Yeah.
along with being prepped for those appointments is finding a provider who really can help.
Right. Yeah, and that's one of the big challenges, and I have seen it improve from a dementia standpoint just in the
Mhm.
course since, we started dealing with it with my mom over 10 years ago. At that point, we were educating medical personnel on a regular basis.
Yeah.
Like, yeah, she's nonverbal. You can ask her name. She's not going to tell you because she can't.
Hmm. Yeah.
And having that conversation 5 times in a row during a hospital stay was
Yeah.
like, really? Really? We don't know this.
Yeah.
Okay.
All right, here we go. I know. I know. It's so hard for people. I think I mentioned to you before that I did a prep with patient for their appointment, and their neurologist basically said, if Molly has these questions, she can make an appointment so I can bill Medicare. And I was like, "Ugh, even if that's what you feel, you just, didn't do any justice for the patient who's in front of you who needs help.
Right.
Um,
Yes.
so in that scenario, and then there's really great ones. So there are primary care doctors who are like, okay, where, I appreciate this education. Where do I need to send this order to? How do I need to, what's the verbiage I need for Medicare to have this covered? And
Mhm.
different ways to keep advocating for people who can't necessarily advocate for themselves in this field,
Right.
or don't know how to, or where to start.
Yeah. Well, and that's the big challenge, right? The way that the system is set up, it's set up expecting that you have some much higher level of understanding of the way the healthcare system works. And not only that, but the vocabulary that goes with it and knowing all of these terms and what they mean. And if you're not in healthcare, you don't you don't know. You don't have a reason to know. Just
Yeah.
like, somebody else going into a school saying, I
Yep.
know how to run this class. No, you don't.
Right. Right. Or the financial aspect of it is
Yeah.
something that I get questions about a lot, because Medicaid covers some long-term care if you qualify for it, but you may not qualify for it, and you may have to adjust your assets and move them around. And that is, that's over my, I know the initial part, but that's over my head a little bit. And that's where I think the multidisciplinary holistic approach is
Yes.
so important. And with Health Advocate, the exposure I've had to, I keep saying the deficits because I guess that's what it is, but I sometimes don't know if it's like purposefully complicated or not, but after years of this exposure, I can't not advocate for people, because I do have, or we do get this awareness and
Mhm.
education on how to tackle these issues. So,
Yeah.
and I think with caregiving, it's not just the physical part of it that you're doing or the task. It's everything. It's life. Caregiving is just a huge part of life, and that isn't just a neurologist issue or just a primary care doctor issue. It's all of it.
Right. And everyone is going to be involved in some way at some point. I
Mhm.
mean, best case scenario, you're only involved on one part of the spectrum. But most folks, you're going to provide care, you're going to need care. So
Yeah.
everybody needs to get on the train.
I know, and it's actually been really nice to as we were, developing the program and being in different calls and sales calls, which I didn't use, as a clinical department, I didn't have to be in the sales calls, but the sales calls are revolved around people's caregiving stories. So it's people from all over, different employers and different, not ranking, but C-suite,
Different
sales, clinical,
roles.
who have
Yeah.
different roles, HR, all of it. And everyone has a caregiving story, because you're right, it's going to
Mhm.
affect us all. We're all either going to need care or provide care or know someone who needs care, or,
Yeah.
and there are resources out there. It's just not put together yet for easy access. So it is a field that is trending, which is interesting, but it's hopefully trending because the need has always been there. It's increasing because our populations, our aging population's increasing. People are still having to work and take care of their families. So I think
Yeah.
the awareness is late, but it's here and it's happening, and it's exciting that it's happening, and it's happening on a
Yes.
national level. So I think,
Right.
I really appreciate your content that you and your advocacy and your support for this field, because I think it really requires all of us to just keep moving forward with it and saying, this is necessary. This is what we
Mhm.
need. This can't go anymore without this official support,
Yeah.
because we're not doing anybody a service. Our elderly population, our palliative care population, our caregivers' children who are, suffering because you're taking them out of the picture. If you're raising a family still, being in
Yeah.
the employers,
Yeah. This
um,
is an all hands on deck,
mhm.
multi-generational problem.
Yeah.
And I'm glad you raised that point of it is changing, because it is.
Mhm.
And, you're starting to see national coverage, and you're starting to see stories pop up in more prominent news outlets. Um, and people are talking about it more. So for the folks in our audience who are like, I don't have the energy or I don't have the time, we don't expect you to do what we're doing. Like, I'm on the other side of my caregiving journey right now, which
Mhm.
is why I'm able to do this. But if you're looking for a way that you can help, just talk openly among your family and friends about what you're going through and what you're dealing with. Because the
Mhm.
more people who are open about it and express what the nitty gritty is, because it's easy to kind of just push it off to the side when you hear, oh well, yeah, I'm a caregiver. People can make that whatever they want in their head, especially if they haven't gone through it. But if you
Yeah.
say, I'm spending 40 hours a week, it's a full-time job
Yeah.
on this, in addition to my full-time job, in addition to
Right.
raising my children and, taking care of my dog or whatever.
Yeah.
It's a huge amount of your life. And I think that's one of the reasons people struggle so much when they keep it inside, because
Mhm.
you're hiding a whole part of yourself. And that's just not good for you on so many levels.
Yeah. And when you reach out, I would reiterate that. Always reach out for help, because you don't know, something might shine through. It could be that someone could say, "Oh, I could come over Tuesday afternoons. I didn't realize that's what you needed." Or it could be someone could say, "Do you know HR has a support program that you can reach out to and do this for?" Um, and I think caregivers give the best feedback and tricks and all tips and all of it.
Yep.
Working with caregivers has allowed me to share that with other. I feel like I'm like a
Mhm.
portal from accepting
Yes.
all of this information and tips and tricks, and then sharing it with other people. And that
Yep.
is, I think, a really important part about reaching out and asking for help.
Yes. That is a huge key. So sharing your story is one way that you can contribute. The other way, as Molly just mentioned, ask your HR professional, if you're still working full time, what services are available, what benefits they already have. And if they don't have anything specific to caregiving, mention health advocate
Mhm.
and see if it's something that they would be willing to consider. A lot of this is we're holding ourselves back because we're not speaking up and we're not bringing things to the fore. So if your company doesn't offer it, it may not be because they don't want to, they just might not know it exists.
Mhm.
So asking the question is a way to put it on their radar.
And it sometimes it doesn't exist, you know, and
Yeah.
it's just starting to, which is again why I really appreciate Health Advocate for recognizing this as a need and putting
Mm.
their effort into creating a program like this. And I have seen them start to pop up in certain ways. And I think, you know, also I think with caregiving, sometimes you're not a lot of times you're just in survival mode. So you're living
Yep.
here, you know, in survival mode.
Absolutely.
So you don't have time to reach out for help, or you don't have time to, or if you do, someone might say, oh, I used this agent, or I'm trying to think of even a resource that someone sends you, but you may not even have the ability or time to go through that resource and see
Yep.
what it is. And so I think having efficient access to resources that are there, and more programs like this, that, you know, more programs like the Generations program out there to really help support, so you can just reach out no matter where you are on the journey
Mhm.
for assistance.
That's great. Um, so because you've spoken to so many caregivers, and you've learned tips and tricks and things, is there anything that sticks out in your mind as like the one thing that was like, oh, I never thought of this. This is great. Everybody should know this. Is there something like that? I know I'm totally putting you on the spot.
No, that's okay. I think with each diagnosis and situation, there's different things. I'm trying to think of like something exactly. I mean, humor. It
Yeah.
wasn't surprising to me, but finding humor, finding something that's joyful in the process, encouraging yourself and knowing that you are doing something that's awesome. It's actually something that's like saving our economy as a
Yeah.
caregiver. And then, yes, there's been like very specific things where I like I'm trying to think of exactly one of them, but
That's okay.
um
The
well, there
humor
was someone
thing's
with the
important.
yeah, yeah, and just I was just thinking of like someone had a behavior where they would kick over trash cans and just knock things off shelves. So
Mm.
they put like fake books on the shelf so they could just knock it off, and it's not really all the books. And just I think it's more understanding that there's all different symptoms and behaviors, and
Mhm.
they are unique, but there are possible answers and potential improvements that can go out.
Yeah.
So that was a long-winded answer. Basically, I think
That
finding
was a good
humor
one.
in finding humor in whatever you can. That might be my
Yes.
like silly sarcasm coming out too, but I
Yeah.
think
No, I the whole reason, and I just recorded this morning my introduction to this season of podcast, and I realized I forgot to explain why it's called Carefulist the Podcast.
okay,
But I'm a huge Mel Brooks fan, and
okay,
Spaceballs is one of my most favorite movies. So, Spaceballs, the lunchbox, Spaceballs, the whatever. So
yeah,
naturally, the podcast is Carefulist, the podcast,
I
um,
love it.
because humor is what saved my sister and I, and my dad, but my sister and I just have a similar sense of humor. So when things would happen, they could be really, really depressing, but we would find a way. And, it's just a coping mechanism, right? So
Mhm.
I'm not going to share the jokes because some people would laugh and some people would be like, wow, you're a terrible
Offended.
person.
No, I know. I'm always the same. When I do a joke, I'm like, was that funny or not? You know, sometimes it's silent and sometimes people really appreciate it.
Yeah. So anyway, the humor, it was the big thing for me. And
Mhm.
so I appreciate that you mentioned that. Is there
Yeah.
anything else that you'd like the audience to know about Health Advocate or about just the caregiving process in general?
Um, I think in general, there are a lot of steps that have to be taken, which can feel overwhelming, but they can be prioritized in an efficient way. And I think, reaching out to someone who can help prioritize that for you if you can is really helpful, because sometimes when you're in it, you don't know what is the priority. If you're
Right.
caring for someone who's bedbound and changing them and all of that's the priority, but there are other things that need to happen to be able to have support for you. So I don't think
Mhm.
anyone should be doing this alone. I wish that we were a little bit more ahead as a society in this, but we are getting there. So the positive is that it is moving. It was a forefront issue in the election, and it was like top 5 issues. It didn't make the debate, but it was right there.
Yeah.
So, you know, um, I think there is a positive in this, in that it is trending in a positive way to acknowledge this type of support.
Yeah.
Generations, I think, is a program setting a precedent that hopefully other employers will pick up, because
Hmm.
um, employers are being affected by this, whether they want to admit
Yes.
it or not, and they
Right.
have the ability to be a huge part of this change to support caregivers. So I think, yeah, just reiterating, reaching out to your HR to say what kind of support I want to.
Hmm.
I want to stay here. I want to be proactive in this role, and I need support to be able to balance all of this. So, what
Hmm.
kind of support can you offer me? Um,
Yeah.
because one of the survey results is that 90% of people would choose a job who offers caregiving support. So, with
Yes.
that, if you're an employer thinking about this, you'd be missing out on a lot of people who
Hmm.
could be, really great employees. So I
Yeah.
think that is something that I would reiterate.
Yeah. Oh, and that's a great point, that it's a major source of recruiting. And if you're recruiting and you're trying to get top talent and
Hmm.
you have a caregiving program in place, you're going to get a lot of interest, a lot of
Yeah,
qualified interest for sure.
yeah, yeah.
Well, this was
So
great. Thank you so
yeah,
much
thank
for
you.
joining us, Molly Minnick from Health Advocate. For those of you in the audience, I have Health Advocate listed on our website, and you can look for social posts associated with this podcast coming shortly. All right. Well, thanks. Take care.
Thank you so much. Thank you.
Have a good one. Take care,
You
everybody.
too. Thank you
See you
so
next
much.
time.
Bye.